One more common thing is complication is there will be microangiopathy. Don't get confused. Micro means small, angio is blood, micro blood. So this is a complication in small blood vessels and large blood vessels. There will be thickening of the this thing, blood vessels. When the blood vessels are obviously thickened, blood supply will not be enough. For example, if it takes place in the coronary arteries in the heart, there will be vascular occlusion. So it might result in myocardial infarction. Okay, it takes place in stroke, other parts of the body, it result in stroke. Similarly, it will also have an effect in the blood vessels, in the eyes, in the renal, I mean like in the kidney. So that will cause renal failure. The complications. It's not. This is just a, you don't read whatever is there inside here. These are unnecessary and you won't understand. So, for example, this is the normal blood vessel. This is an electron microscope picture. There will be thickening of the. This is a cross section. Okay, it's like a tube. When you cut the tube in the center, and you see from the transverse section, it will be like this. So, this basement membrane will be thick. So what happens? The amount of blood flowing inside this blood vessel will become reduced. When there is no, and again, for example, if the tissue resistance is less over here, glucose will not be absorbed. Whenever it goes to different parts of the body, it will not be absorbed properly. So when this in other parts, it will cause you reasons like myocardial infarction, stroke, nephropathy, and all those things. What happen? It also this microangiopathy. Right now, okay. See, from now we'll be talking about oral cavity. Okay, so it will be important for you guys to listen to this. So, what happens in the what happens in microangiopathy in case of oral cavity? What they've observed is there will be thickening of the basal membrane of even the gingival vessels. Gingival vessels, there will be very small capillaries. Even when you see that, like I showed the previous picture, it will be thickening. So here, what happens in the heart? We saw that there will be vascular occlusion. Basement membrane is gets thickened. The walls become very thick and weak. Again, the same thing, it results in peripheral occlusion of the vascular cells. So when this happens, there is decreased tissue perfusion. The amount of blood that will go into the tissue will be very less. For example, when there is less amount of blood going into the tissue, which means oxygen is less, which means that the amount of neutrophils that go also will be less. What happens when blood is less, when oxygen is less, and your defense cells are also less? Obviously, cells will be, I mean, the body will be the whichever tissue it is supplying, it will be devoid of any active healthy mechanism to fight off any infection. So that will cause chances of infection. Okay, predisposes the body to infections. So is it okay? This is the. Do you guys understand this slide? This slide is very important. Is everyone there?
Yes, sir.
Okay, others who understood this slide?
Yes.
Okay, so this is I've just repeated twice about microangiopathy. Okay, when such a thing is happening, the amount of blood that is going into the tissue will obviously become very less, and then thereby causing the decreased tissue perfusion. Oxygen will be reduced, all the nutrients that are going into the tissues will be reduced, and again that will predispose to infection. Okay. Now we go for the oral manifestations. These are very important, so you can take note or just take a screenshot. So the common things would be periodontal disease, periapical pathology, caries, xerostomia, hyposalivation, taste disturbances, and BMS, BMS meaning burning mouth syndrome, and other mucosal oral pathologies. Most common thing that you would see is periodontal disease. Like you would obviously see when you see a patient, the next question will be that do you have diabetes. It will be very obvious that despite even at a younger age, 40, 45, they'll have a very, very poor oral hygiene and poor periodontal status. These are the basic things we'll discuss about in detail. Take a screenshot of this. So basically, like I said, these are the main oral manifestations. Diabetes serial adenosis. What happens in diabetic serial adenosis? This is not very common. This is one important, so I've just put it in that order. So there will be non-tender bilateral enlargement of carotid glands. Non-tender is it won't be painless, but you can see that on both sides the cheeks it will be enlarged. So it's because it is nothing but an inflammatory enlargement of the carotid gland. So what happens when that happens? The parotid gland is a salivary gland. It is not, if it is not functioning properly due to some inflammation, that will have decreased salivary flow. So what the decreased salivary flow causes? Xerostomia. Okay, xerostomia is nothing but dryness of mouth. That again is a very important thing. So, like I said, when there is decreased tissue coefficient of blood, that will cause less amount of this thing. Neutrophil function also will be compromised, and there will cause chances of infection. Right here, in terms of tissue and in terms of oral cavity, you also have the role of saliva playing. When there is decreased amount of saliva that is there in the oral cavity, and your mouth becomes very dry. Okay, even you would have noticed when your mouth becomes very dry, it can, there can be some kind of a bad odor coming. Okay, so that is because of the microorganisms that are there by nature. So what happens? The microbial flora is altered. Okay, the chances of infection is more. It is like a sequel, one by one it will happen. Okay. So then what happens when you have more, you're not cleaning properly, the patient is not able to maintain properly, the amount of microbial flora is more, multiple caries lesions will start happening. Okay, the first four, they can be interrelated. All those multiple caries lesions will be interrelated. Next, again, more susceptible to oral candidiasis. Normally, it can be erythematous candidiasis or pseudomembranous candidiasis can also happen. So, why is that so? Like, for example, we spoke about increased chances of infection, right? So, when that happens on the oral cavity, I mean, like on the palate or tongue, it will result in candidal infection. Okay, and the same thing, the same effect when it taking place on the tooth surface, it will end up causing multiple caries lesions. Okay, that is about tooth we saw, then we saw about palate and tongue. So what happens in the gingiva? Gingiva, we saw that there is some problem with the gingival blood vessel. There is evidence. So what happens is, they are very commonly, you will have spiking erythematous gingiva in case of periodontal disease. There can be, there's something called as diabetic patients, when they are more likely they are uncontrolled, there will be multiple abscesses. It will come in one place and will go. It will be like it will come in different places. So that is again a very common sign of a diabetic patient. Multiple periodontal or periapical abscess will come and go. So when there is a particular source of infection, it will come in that place. Again, it will go to a new place. That is one thing. Okay, periodontal diseases will be more progressive and more frequent in case of uncontrolled diabetes. Also, in case of normal diabetes, also it will be more frequent compared to others. Okay, this is something to do with the periodontal thing. So what happens? One more important thing about type 2 diabetes mellitus is poor wound healing. Okay, most common problem is when they are in uncontrolled diabetes. Uncontrolled diabetes somewhere where patient is not able to control the diabetes. If you go to 600, 400, suddenly 200, next month it will be 200. It will be very uncontrolled. For example, some patients at one point when they are 50 plus, 60 plus, or sometimes even when they're 80 years old, they will have their sugar levels maintained right at 200. It will be 200, 200, 300, 300 forever. Okay, that is controlled. Okay, when it is uncontrolled, every month it will fluctuate. The body will not be able to tolerate the amount of blood. It's simply because the function in the pancreas is not doing its function. Whatever tablets they take, they are not able to manage. At those times, they will only start taking insulin will be there. So what happens there is there will be extreme delayed wound healing will be there in terms of, again, why? Because the oral cavity we already saw that the blood vessels, they are not carrying even enough amount of oxygen. The tissue perfusion is less. Even the defense cells which are supposed to, for example, the wound is there, it's supposed to make sure that the wound healing takes place properly, right? So when all those things are affected, it will cause some delayed wound healing. Another thing is zygomycosis, otherwise called as mucormycosis. We'll see a picture later. So that is again an invasive fungal lesion. Okay, it's not very common. It can occur through any and sometimes in the oral cavity, it will both there in the sinus and also in the oral cavity. It will perforate. We'll see one picture later. And another thing is benign migrating glossitis and taste disturbances and burning mood syndrome. Okay, I think we have 15 more minutes. See, that's why we can. So this is again very important. So when on one side you see that when there is poor glycemic control, heart, kidney complications, all those things can happen. Like I said, because of enteropathy, atherosclerotic reasons will be there. Basically, it's all about the microangiopathy and macro and microangiopathy. So what happens here when there is decreased salivary flow? It will obviously result in caries. The caries will obviously progress. Sometimes if not taken care, it will go to necrosis, and they will finally eventually lead to periapical pathology. When there is a periapical pathology or a periodontal disease here, when the glycemic control is less, when it is very poorly controlled glucose, it will not help your tooth. It is not going to do any favor for the tooth. It is only going to further damage. For example, you do a periodontal deep scaling, there is no use if you are not able to control your diabetic sugar levels. Same applies for this. You have excess infection, you do a root canal, you cannot expect magic to happen. The sugar level also should be controlled. Because for this to heal, for this place, for this abscess here to heal, the body has to do something. You cannot take tablets for it. Okay. This is one more important thing. You understood till here? Any doubts? These two slides are important for your
No, sir.
exam point of view or questions. Okay. These are the basic things. This is the film, all these things. You can put up some photos, pictures, and things. Now here, this is too much. Don't worry. And these are the overall thing. Like for example, commonly it will be about the periodontal diseases, pregnancy, periodontal pregnancies in the vitis. And why are we talking about lichen planus, oral cancer, and all over here? Simply because, for example, in diabetic patients, his immune component is very bad. Any ulcer can turn into a cancer. For example, 50 plus female patient, hormonal, other hormonal problems are there. At times, lichen planus, lichenoid reaction can also take place, even due to other drugs used to treat diabetes. Okay, they can again cause salivary dysfunction. That salivary dysfunction, whatever we saw earlier, cause thyroid enlargement, decrease salivary levels. So, moreover, it's just the same thing. This is just an overall picture of what can happen. All these things can get bad. Okay, all your recent periodontitis or your ulcers, candidiasis, caries, all those things, Fisher tongue, everything can get bad if it is from the study. If the glucose control is very poor, and it can also be worsened because of cigarette smoking. Okay, just finish up with some pictures. It's very common that in uncontrolled diabetic patients, you will see all these things. Okay, excessive calculus, there is obvious periodontal problem here in their recession. And probably this patient was wearing a RTD, there is food accumulation and tooth caries started. You can see this is the common thing, periodontal disease, and you will also see spacing because of the periodontal disease. Okay. So mucosal changes, aphthous ulcers can happen. In aphthous ulcers and lichen planus or lichenoid reactions can lead you to the tongue. Again, the tongue when it becomes very dry, they are prone to all these things. When they are deficient of vitamins, they'll be prone to aphthous ulcers. You can depending on the type of ulcers, you can change the medication. Whatever it is, the glucose level has to be maintained. Ulcers, you can go with the topical treatment, and then you can also try out vitamin supplement, legal supplement. It will subside, not an issue. Otherwise, it is very bad. Lichen planus, similarly, other hormonal changes will also be there. Okay. In detail about ulcers, lichen planus, all those things will be dealt separately. You only see the manifestations here. Okay, this is an obvious CD patient, complete NSA patient. He's been wearing it, she or he has been wearing it for a very long time. You can see that this area has been entirely erythematous. For example, if you take a swab of the palate and also the swab of the this thing of the denture, you will see a Canada definitely 100% will be. And this is a prolonged denture wearing. When you wear this denture for a long time, sometimes the denture is not made properly. Also, there will be loss of vertical dimension. What that causes, that will cause angular cheilitis in the corner. This again sometimes will be susceptible for more infection. So it should be it should not be dehydrated. That's why there's sometimes you can apply Vaseline for the denture has to be eventually corrected. This is the tongue where you see a median rhomboid glossitis. Okay, this is again, it can have candidal infection over there. That's why that part alone is divided or anything. For example, if this part that goes and touches on the palate during swallowing or during eating, or even during rest position that will actually rest in this area. You can see that even those areas will have that kind of lesion. This is, and again, this is the same patient on the left side, which is there, the same denture patient. You can see fissures on the tongue. Okay, fissures again, they are part of the mucosal changes, where mainly because of dryness of mouth, there will be lack of prone to infections also will be there. Because of that, cause a lot of fissures. These are common ones. Sometimes the fissures will be very bad, even in a young age. This right side is not a diabetic patient, but I just wanted to show you how bad it can be. I hope you've seen much more cases where the fissures will be much more deep. At one point, patient will not be able to eat properly or even chew anything because of extreme burning sensation. The loss, there will be loss of taste buds in this case. Benign migratory glossitis is another important feature. Benign migratory glossitis, the name itself suggests that there's nothing to worry about it. These are like small geographic areas, it keep on moving. So type of infection, but it is nothing to worry as long as you have you can also see fissures here, right? The same patient, there is also fissures here. As long as this thing is, what is it? The glucose level are all maintained, obviously there's nothing to worry. But the problem here is, for example, in these areas, when you have the candidal, superimposed candidal infections will be there. So that if that happens, it can be a problem. Earlier, it was thought to be a candidal infection mainly because of the color, white areas. Okay, but again, in these fissures, if there is food accumulation, it can also cause this thing, any type of superior infection. So what is important here is mainly maintenance of the oral cavity, and then make sure that the tongue is clean and you eat a lot of vitamin supplements. You can only do symptomatic treatment for this, just to make sure that it is not getting worse. Again, another thing is the mucosal pathologies, oral lichen planus. This is one type where you can see like Wickingham's white network lace-like pattern is there. So this is one more thing. This can be worsened because of any associated autoimmune disorder, or even the immunity is very less, and because of poor glycemic control, it will be very. We're not going to talk in detail about this. Again, it's a very separate chapter. So separate topic to be taken. In these cases, the patient will have severe pain, burning sensation, difficulty to eat. Okay, you can manage this with topical steroids, immunosuppressants, and sometimes basic, mucosal, topical mucosal ointments also will be useful. But when it is not okay with this thing, what is that? Topical steroids and tacrolimus or immunosuppressants, then you might have to go into this thing, systemic steroids. Problem is not only glucose. For example, in case of female patients, after 50 years, hormonal changes will be there. So even that time, when the thyroid levels or anything is not regulated properly, all these things can happen. In terms of lichenoid reaction, the problem there will be about the drugs that are used. So the difference between oral lichen planus and lichenoid, that will be only based on the biopsy that we do. Okay, we have to rule out this. See, when these things happen, you cannot just concentrate only on the oral cavity alone. You should be concerned about the patient in whole. When a patient comes to you, you cannot expect just to treat this and expect the diabetes to be controlled. You should be aware what is the reason causing this. Why is this happening? Okay, I've noticed that patients' thyroid levels were very bad, and the diabetic levels were there, but the thyroid levels were very bad because of the age, and post-menopausal age, all those things were happening. So you should be concerned about treating the. You cannot treat the other causes. At least you should be able to refer. You should know what to be done there. Okay. So this again is mucormycosis. You can see this is very invasive, highly invasive. Treatment depends on what stage you are trying to treat it. Sometimes it can be there in the sinus and then invade into the oral cavity. Most often it happens like that. Otherwise, for example, in extracted socket, if there is these fungal organisms grow, then it can penetrate and grow into the oral cavity as well. So this is one thing. So this is highly invasive. Treatment-wise, antibiotics are only started with antibiotics. They say amphotericin is also good. Again, this also will be discussed later for you in the specific chapter. Okay, so dental conservation, I think we can take a screenshot of this as well. So periodontal disease, forget about the pathogenesis. I mean, like if you understand, you can take this periodontal disease. Uh, Age and all, you won't understand. Age, you might not understand. So there's obviously a rapid progression of the periodontal disease. Treatment, you can see, you should know the reason. Like I said, with like whatever it is, periodontal, dry mouth, root caries, candidiasis, necrosis, pain wound bleeding. If you're not able to know that it is because of diabetes, all these problems are happening, you're not going to solve the case at all. Okay. Root caries, like I said, we saw for gingival resorption and decreased salivary flow will be there. Okay, candidiasis, again salivary dysfunction, hyperglycemia, and immune system. You can see the treatment options that are available. Antifungal will be given for oral candidiasis. Pulpal necrosis, you know that you have to do an endodontic treatment. If the condition that is that it has to go for an extraction, or even in case of a diabetic, uncontrolled diabetic patient, you have to do a complicated extraction or something like that, or any surgery, you should be concerned about their glycemic control. You cannot afford to do a heroic case in case of uncontrolled diabetes. You know, it can cause extremely bad delayed wound healing. Make sure that the glucose is in control. Even if you're going to place an implant, make sure that the glucose is in control, and then you can do it. Obviously, you can give preventive antibiotics, but you cannot go ahead. Even if it can be a simple case, it can be a periodontal case. You should be able to judge whether it will heal soon. You know, you cannot go for multiple extraction at the same time. You have to wait and do. Okay, so these are the basic things.